Hello everyone. Today I'm gonna talk on how to do microneedling at home safely, how it can be performed at home. My skin must be looking very greasy to you because I have applied a numbing cream over my face because I'm going to perform microneedling on my face. So I have applied this cream on my face 45 minutes before the procedure. So it was almost to be 35 minutes now when I have applied this before. So I will show you what cream I have used. I have used a lidocaine and prilocaine gel coming by the name of Top Lab gel. So this one comes as a tube, in a tube form, in a cream form like this. So here is a tip. If there is a seal on the front of the knot of the thing of the tube, so you have one sharp end thing, pointing thing, and you can just insert it and it will open up and the tube will open up and it will start to come. So I have already applied some 45 minutes back 2 layers of this Top Lab. 15 minutes later in the between the time, so I applied this 2 layers especially over the region where I want to do the dermaplaning, microneedling. So after that I'll be using one Hyalo gel. So this is a Hyalo gel. This is a hyaluronic acid gel. I'm going to apply it a thick layer over my skin wherever I want to apply and do the microneedling. And this is cold because it was refrigerated, so in a way it acts as more of a soothing this thing also, and will cause less erythema over the area. So you can see both of the cream and the gel are mixing, and it's forming a white paste over my skin. Definitely it's not at all a photogenic look to have, but then I'm gonna use my microneedling roller. This is a 0.5 mm roller, okay, and it has got some 540 needles. I have already sterilized it for almost 20 minutes in 100% spirit. Okay, so you can either sterilize it in 30 minutes in Savlon, in non-diluted Savlon also, or 100% spirit for some 15-20 minutes. So these are having sharp tips, pointed tips at the end, multiple, which are gonna create multiple puncture wound over my skin. And these multiple puncture wound, which are very microscopic in nature, very micro, very small, they are gonna cause collagen rejuvenation, collagen regeneration in the dermis layer of my skin, which will lead to the skin having whatever issues you are tackling with addressing with microneedling being addressed. So okay, so I'm going to start. What we are going to do at each area, at least 15 to 20 motions should be there, and these 15 to 20 motions are divided into 5 vertical, 5 horizontal, 5 diagonal, another diagonal, left diagonal, then 5 horizontal. Okay, so it is coming to be around 20. Okay, so at every area 5 vertical, 5 horizontal, 5 diagonal, and then 5 diagonal. So we are going to do it in this way in each area: the cheeks area, the forehead, left and the right forehead side, and then the jawline area. Okay, and some other area if you want to address your upper lip area or the chin area. So we are going to start with the microneedling of the left cheek. So I'm going to push this down with gentle pressure, not too much pressure too, and count it. I can see already the erythema forming. 1, 2, 3, 4, 5, 6, 8, 9, 10. 1, 2, 3. So you can see in all the direction I have done it in this area, and that is why now it has become red. And I did not feel that much pain because I had applied the numbing cream and I had another gel layer coating this area which was very cold and refrigerated. So now again I'm gonna do it over my cheek area, lower cheek area and the jawline area. So my lower cheek is also done, only my upper lateral aspect of the cheek is remaining. So I'm gonna start it over this region. Here over this area I have a little bit laxity, so that's what I want to address with this. So I've done it in the vertical motion. Now I'm gonna do the diagonal motion, and I can feel the needles pinching into my skin. So in the same motion I'll show you in fast forward how I'm gonna do it over the forehead also. It might be very painful during the first time while doing it the forehead. So I'll also do it in the fast forward motion. Yeah, on the forehead it's quite difficult to do. Coming back to the lower cheek. So I have almost covered my whole of the lower face and the mid face. So I'm done with the micro needling of my face for today. So here is the maximum erythema, the redness I'm feeling, and I'm feeling it a little hot. So I'm gonna make another video for the aftercare of the micro needling. So here I'm just gonna stop with this one. And if you are new to my channel and if you like the content I'm making, kindly subscribe to my channel and press the bell icon button for notifications, so that you will be notified whenever I make a new video. And kindly share the video and like the video. Thank you so much. See you in my next video.